welcome to today's webinar on building an efficient medical cold chain infrastructure, a roadmap to effective healthcare delivery, brought to you by B Medical Systems in association with ETHealthworld. The impact of immunization during the COVID-19 pandemic has been profound, underscoring the critical value vaccines play in safeguarding public health. Today, we embark on this journey to explore India's remarkable immunization efforts and the challenges faced in vaccine delivery. I, Rashmi Mabyankor, Principal Correspondent at ETHealthworld.com, would now like to welcome the esteemed speakers who have joined us today to dwell on the intricacies of vaccine delivery, role of sustainable cold chain systems, the meticulous strategies employed to ensure vaccine coverage reaches the last mile. To take forward this crucial discussion on building an efficient medical cold chain infrastructure, please join me in welcoming our eminent panelists, Dr. Madan Gopal, Advisor, Public Health Administration, National Health Systems Resource Center, Ms. Urvashi Prasad, Director, NITI Aayog, Professor Dr. Anurag Agarwal, Professor, Department of Pediatrics, Maulana Azad Medical College, and Mr. Shahaab Javeri, Senior Director at SELCO Foundation. Thank you so much for joining us. Unfortunately, Dr. Adappa Karthik couldn't join us today due to a sudden meeting. So, before going ahead, I would like to inform everyone that the panel discussion will be followed by a question and answer session. Attendees can share the questions in the chat window, and our team will be addressing it towards the end of the session. Now, without any further ado, I would like to begin by exploring what are the most prevalent challenges. So, starting with you, Ms. Urvashi, what are some of the existing challenges and policy gaps in current vaccine delivery system? And do you think there is a need for more stringent policies? How can this be helped by technology in bridging the existing gaps?
Thank you for inviting me for this discussion, and thank you for the question. So I'll talk about not just vaccine, but the overall pharmaceutical or medical sort of supply chain and the cold chain infrastructure in relation to that. So I think historically in India, we have had a big challenge with our logistics overall. And there has been an over-reliance on road freight, unfavorable geographic conditions in many parts of the country, poor cold chain infrastructure, and lack of a sustainable network. So even if you see our pharma distribution, over 70% of it is dependent on roads, and that exposes biopharmaceuticals to degradation due to uneven topography and high temperature. And moreover, in obviously health, in this space, at least 20% or even more of the temperature-sensitive health products are damaged on roadways, due to the deficient cold chains. So cold chain infrastructure, historically in India, because, now we have, of course, started to address a lot of these issues, especially by using technology. But, since you've asked me about challenges, I'm speaking about, the challenges first that we have had historically. And of course, a lot of them we still need to address in many parts of the country. High capital costs, the lack of skilled resources, the poor reverse, logistics, or not having access or integration of the latest technologies. So these are, of course, legacy issues, that the country has had to deal with in this space. But in fact, if you see pre-pandemic, the cold chain network in India was still in its infancy, but then we had a soaring demand for vaccines, the COVID vaccines, we had rapid distribution requirements. And so that has really helped to transform the sector, and now we are seeing storage and transportation facilities evolving with cutting edge devices and optimized routes. We are, seeing cold chain logistics embrace innovations, including the best of global innovations, to kind of bring the best facilities to India. So, if I just give an example here of, you spoke of vaccines, that medicines, vaccines, they require strictly regulated temperatures. And the temperature demands vary, according to the composition. So it's not any one particular, temperature which is required. So live virus vaccines, for instance, they thrive in, say, the 2 to 8 degrees, spectrum. But if you look at mRNA vaccines, and that's why India didn't go in for a lot of the foreign vaccines, because these mRNA vaccines require as low as minus 70 degrees to remain effective. So because of this broad temperature range, the ultra low freezers, are now gaining importance in storing vaccines, preventing spoilage. And basically, you're seeing a lot of technological innovations coming in. So there's remote sensing, for instance, because, vaccination programs require temperature regulated equipment in health centers. So now we are making the use of remote sensing. There is smart tracking, so that, the supply chains can be tracked using IoT and robotics and AI, etc. So there's a lot of advancements, and I can talk, of course, more in detail. But just to say that, even pre-pandemic and post-pandemic, we've come a long way. But of course, there's still a lot more we need to do in terms of addressing the inequities, because we're a very large country. And there's obviously, very, very different geographical and other logistical conditions which are prevailing across the country. So we need to be able to address the remaining gaps and the disparities and the inequities. But we've made huge progress, and technology is really the next frontier for us in, taking us to the next level.
Very nice views. So the same question is for Dr. Madan. What is your opinion on how we can tackle these challenges?
Thank you, Rashmi. One of the first thing which I want to say, that we are having the largest immunization program in the world. That's one thing from the public sector side of point of view. The other thing is we started our immunization for addressing the vaccine preventable disease way back in 1978. So then looking at the success of that, previously it was 6 antigens. Now we are covering 12 antigens. That means we are providing immunization, universal immunization program against 12 diseases. That's one thing. Second thing, when we are doing the immunization, because we should appreciate that every year we are having a cohort of around 2 crore children which have been added up, and we are providing immunization to all these 12 crore people, 2 crore people. But having said this, over the last many years, over the last, I think 3-4 decades, we have been able to streamline the immunization process in the country, which is the largest immunization program of the world. Every year we are immunizing the pregnant women around the same cohort, that means 2 crore and 2 crore. That means we are immunizing them against this polio, TB, polio, DPT, MMR, measles, rubella, mumps, measles, rubella, then rotavirus, pneumococcal, Japanese encephalitis. We are inoculating them. That's one thing. But over the years, we have built in a system. A system comprises of, that means from the vaccine manufacturers right up to the beneficiary, the cold chain is maintained. That means we have invested a lot into the cold chain. And the example, the reflection is seen when we inoculated the COVID vaccination. Had it not been the capacities which we have built in over the last many years, it would have been very difficult to inoculate 2.5 crore vaccination in the day. That was the capacities which we were having. If you talk about the system which are there, from the vaccine manufacturer, the vaccine reaches the GM, the government medical store depots, which are there at around 4 or 5 places. At all the state places, we are having a state walk-in cooler and walk-in freezers. That means the vaccine through insulated, that mechanism is there. Through insulated vans, it reaches the state walk-in coolers and the walk-in freezers. From there, it is sent to the districts, where district also you are having a store. From there, at the CSCs and the PSCs level, you are having deep freezers and the ILRs, ice-lined refrigerators. Because looking at the terrain and the difficulties, we have evolved our scheme to see that even in case of any power outage, the vaccine is not spoiled. That kind of mechanism has evolved from the CSCs and the PSCs. The vaccines are transported to the immunization site through the vaccine carriers, through cold boxes and vaccine carrier. It is happens. Then mechanism has evolved, and we have perfected that thing. The other thing, important thing which has happened, because to identify the challenge, we should understand the system first. Other thing which has evolved over the many years is when so much logistics are involved, so much number is involved. So we have tried to evolve an electronic vaccine intelligence network, that is EVIN system. It was meant for cold chain maintenance and logistics, this, which was eventually become the CoWIN platform, which we have seen the beauty of that CoWIN platform. So electronic vaccine intelligence network was there, which has helped us in managing the logistics. That's one thing. So this is a network which is available. That means from the manufacturer to the beneficiary, we are trying to see that the vaccine potency is maintained. The vaccine potency can only be maintained, or the efficiency can only be maintained when the cold chain is maintained. So we have invested a lot, right from creating stores, regional stores, to the deep freezers and the ILRs and this. Deep freezers can be run on electricity, on solar, and other that different models are there. But essentially, we have invested in that cold chain is there. And I can guarantee that for this 12 vaccine preventable disease, if you are taking an antigen shot in a government sector, then I'm sure about the potency, because we do have vaccine vial monitors to maintain the potency. As we were discussing before going live, we do from the tick methods. Now we are using the digital modes for maintaining the temperatures, and the temperatures are seen on a regular basis. Every 2 hours, 3 hours, the cold chain temperatures are taken. That mechanism is there. But having said this, we still do have some challenges, because there's few habitations. Like recently, we have launched this Pradhan Mantri Jan Man Yojana. Why it was launched? Because there's few habitations where still despite reaching up to a population of 3,000, 5,000 in the form of Ayushman Arogya Mandirs and the outreach through the mobile medical unit, still there are pockets which are remaining. For that also, what we are trying to do is we are having in the Dhanush mission, in the Dhanush program, which was launched in 2000, which is catch-up round, so that the people who are left out, they are covered in the immunization. This kind of setup is there in the public health immunization. We are already doing it, and it is going stronger and stronger. And there are people who are trained and capacitated for doing this thing. But the challenges, now I'm coming to the challenges. The challenges which we envisaged is the last mile delivery. Still, as I mentioned, there are a lot of pockets where we are still to reach. The primitive tribal groups, the prioritized vulnerable tribal groups, for which a special program is launched and the MMUs have been launched to reach this population and these pockets. And to reach this last mile, as I mentioned, in the Dhanush mission and the Dhanush program, which previously used to be the Shishu Suraksha Divas, erstwhile when the vaccine preventable diseases started. The other problem which we face is vaccine hesitancy. If you look at the things, around 29% of the individuals, they still exhibit vaccine hesitance even after 4 or 5 decades of this immunization program. Still, we are struggling with vaccine hesitancy. Even a small, if some antigen, some adverse events happen, that results in vaccine hesitancy, and a lot of communication and other activities have to be carried out to address that issue. Other challenges, the cold chain maintenance. Still, there are areas where power outages and other things are there. Apart from that, breakdown of equipments do happen. That also is being handled on a day-to-day basis, because the logistics management is the key for this. Because if I'm inoculating something, the efficiency and potency of the vaccine right up to the beneficiary is to be maintained, so that I am very confident that if I'm inoculating somebody, then the vaccine would at least start inducing some antibody response into that in an effective way. So cold chain is an important area. So a lot of requirement is there, a lot of things can be done. So apart from that, other thing is human resources limitation. So all the vaccinations happens in the form of what we do. We collect all the people during the village health and nutrition days, and all the people are being inoculated by the auxiliary nurse midwife or the ANM. with the support of Asha and the Anganwadi workers.
Hmm.
But the major thing is some of the areas there is vacancy of the oxygen or midwife. We have to find out, but the NHM has been able to bridge this gap also. This is one of the other challenge which is there. The other thing is when we are inoculating so much number of people, so how the data should come. But fortunately, what now we are doing it, we are trying to capture the data. We are linking all the beneficiaries with Aadhaar because of the beneficiary services. And the CoWIN platform, which was beautifully used during the this COVID times, which was an extension of the e-vaccine system, which was customized to deliver the COVID vaccine. Now we are using that COVID vaccine platform for the universal immunization program, and all the beneficiaries, their ABHA IDs are generated, and now they have been after embedding the ABHA IDs through Aadhaar. Now we have been able to track. Apart from one of the challenges which was there was scheduling the immunization sessions. That session is also now because the logistics is being taken care. What kind of vaccine is available? What kind of stock is available at a particular point? And based on that, how many inoculations can be done in a particular session? That is already done. On a monthly basis, all the vaccinations in the government sector happens through village health and nutrition days, as well as in the institutions, primary health centers, community health centers that are there. Besides that, to address all these challenges, you might have seen three major programs. One is the Ayushman Bhav program, wherein camps have been organized at the community health centers as well as the sub-health centers or the Ayushman Arogya Mandirs, so that the people who are left out, who are not covered, they are also covered through this vaccination program. The other important program which has been government has launched is the Viksit Bharat Yatra, in which we are trying to see that the people who are left out, who are for them also the immunization sessions have been done. The other third program which has been recently launched on the 15th of this is PM Janman program, in which the prioritize the vulnerable tribal population. They are also been covered through MBBS. Apart from that, after all this setup, we do have around 1,800 mobile medical units, and the mobile medical units they have been tasked to provide immunization. A similar kind of mechanism do exist in the urban areas. But I can bet that if you go to any government institution, if you talk about the experience of vaccination in the public sector and the private sector, and the people who have taken inoculation in the government sector for COVID, they will definitely have a very, very good patient experience as compared to others. I will stop here. Thank you.
Okay, so Dr. Madan very elaborately explained us what are the developments that we've gone through. But there still exists some challenges, and some of the major challenges that we are going to be addressing today will be how medical cold chain infrastructure can be sustainable. So my next question is for Mr. Shahab. How important do you think is to develop a sustainable medical cold chain infrastructure, and how can this help in overcoming the last mile challenges?
Thank you, Rashmi, and thank you to the other speakers as well for introducing the challenges. My name is Shahab, of course, but I'm from this organization called SELCO Foundation. We work at the intersection of solar energy, sustainable energy access, and healthcare. So in this process, we are solar powering a lot of health facilities in India in partnership with the Ministry of Health, in partnership with the NHSRC as well. Right now, our target is to power 25,000 healthcare facilities in India by the year 2026. This, of course, covers a large number of cold chain points, especially at the last mile where cold chain is being delivered to the end user. The previous speakers have already spoken about the problems on logistics and last mile delivery, and I want to elaborate on that from our experience. Um, when you're asking for sustainability, the realm of sustainability that I'm considering is also environmental sustainability and economic sustainability. Um, because of this large scale program that we're running, where we're assessing the energy needs and the energy problems in health facilities, while all health facilities have access to electricity, uh, largely in the country, it's 100% electrified. There is definitely two problems with electricity that still persist in a lot of areas, especially remote areas, which is the unreliability of electricity. definitely certain terrains provide challenges to provide electricity throughout, and we can see um, a few hours of power cuts at least every day, and especially during monsoon seasons, etc. Maintenance periods can be very long, and that's when we also see unreliability coming in. Also, in a lot of remote areas, we see power quality being a big issue, and that sort of hampers cold chain infrastructure as well. And the economic link to this is that, and from most of the assessments that we've carried out, we're seeing all the PHCs that are largely storing cold chain at the last mile, they're spending at least 4 to 5 thousand rupees on diesel every month, because to mitigate the vaccine wastage that would potentially takes place. It's a expensive commodity, so you don't want to lose out on it. So you will plan for diesel, but that diesel expenditure in itself is a sizable amount. Even if we consider 31,000 PHCs that are there in India, even if 50% of them are facing this sort of issue, then spending on good sustainable backup sources, especially solar energy, completely makes a business case over diesel expenditures that might be taking place. And because this is a fossil fuel, um, the environmental impacts can also be tremendous when we look at it at a India level scale. Um, this will save our health system so much money in the long run, that all of this money can be actually allocated to reaching the last mile pockets where training and consumer outreach might be a bigger issue, or consumer awareness be a bigger issue. So both environmentally and this, we think that this powering of primary healthcare facilities, of sub-centers, of community health centers is a very important step towards maintaining the cold chain, simply because the cold chain occupies the largest percentage of the energy load of a primary healthcare center as well. The topmost way that, we think that, to give you one quick example, even in a southern state, we were doing, and we had gone for an assessment, and because of regular grid maintenance, the idea was that for half a day the grid maintenance would be going on, but somehow for some reason it got extended for a larger period of time, and an ambulance had to be called to transfer all the vaccines from one PHC to another PHC. Now we need to think about whether the other PHC, that maybe the store is also very far away from there. So does the other PHC have enough space? That creates a lot of challenges in the day-to-day management of the doctors and the health staff. All the energy that they could be putting into patient care. Now, can we reduce that burden on them also is the question. So there are solutions that are already available, very good ones. So I think that it's time to get into this aspect of it.
Great. That's like a positive note here. Coming to you, Professor Dr. Anurag, what are the gaps in storage and administration of vaccines impacting their efficacy? And what should be the best practices while storing and administering these vaccines that pediatricians must follow?
Good afternoon, and thank you for having me on this very important discussion. So, vaccination is one of the very important national programs which is running across the country, and has saved millions of lives across the country. So, the aim is, of course, from control to elimination to eradication of diseases. The best example we have is smallpox, followed by polio, which is now been eliminated from at least India. And of course, COVID vaccines, we had a great experience wherein we were able to fight off the challenge with the massive large-scale vaccinations. Now, talking about pediatricians, so we have to understand that 90% of immunization is done by health workers other than pediatricians. So the pediatricians, of course, they do play an important role. But the majority of vaccination is done by ANMs, Anganwadis, medical officers who are working in PHCs and dispensaries and other government setups. Pediatricians definitely have a major role in creating guidance for immunization practices and developing mechanisms and thought processes by which we are able to increase the coverage and prevent failure of vaccination. So now coming to gaps of cold chain. So cold chain has three important components. One is personnel, that is the health worker, and of course, people involved with transportation of the vaccines. Second is equipment, which implies, of course, again, vehicles for transportation, refrigerators, monitoring equipments, and of course, electricity supply, which is a very important component. And then the procedures. Procedures implies that what kind of guidelines you are following, what kind of trainings you are doing, what kind of audits you are doing, how are you monitoring the whole process. So these three components are mainly involved in cold chain maintenance. Now talking about equipment first. So poor monitoring of vaccine temperature during transport and storage. This was one of the biggest challenges which we have had over last 20 to 30 years. Other than that, the quality of equipment available with pediatricians is another issue. So these two issues have been taken care of over last 2 decades. And I'm happy to say that in government setups, there is a rapid positive development of infrastructure which has taken place. And we have been able to move ahead from the domestic refrigerators to ice-line refrigerators and purpose-built vaccine refrigerators. So this is a massive change. See, whenever you have a program of a scale wherein you are injecting millions of children every year, even a single failure or adverse event which is covered in the media gives a bad name to the program and causes a lot of fear in the society, and which leads to disruption of the program. There are multiple examples to this. We had problems with the MMR vaccine, where there was a story we in Delhi we were not able to do MR campaign for certain reasons. So we have to be very careful and very stringent when we are dealing with mass level programs. So government is doing very well. The electric supply, which my previous speaker was talking about, in cities, it has improved to the level that we are taking electricity for granted. And of course, we have power backups. Yes, dispensaries and PHCs have a problem. They have power cuts, and you need to maintain some kind of a regular supply, because whatever refrigeration system we are using can maintain your vaccines up to some hours, say from 6 hours to maybe 12 to 24 hours, depending upon the model and method we are using. But after that, you need them to have an electric supply so that the whole equipment cools down and it is again functional for next 24 hours at least. So yes, electricity supply is a very important component. Then coming to temperature monitoring, which was once upon a time manual, as I was talking earlier also, wherein a nurse would take out the thermometer from the fridge, have a look at the reading on the thermometer, and put on a chart, paper chart, and hang it outside the fridge. So this was at her whims and fancies, and because she was on duty, she will not give you a wrong temperature because she does not want to be penalized for it. And therefore, the problem was that we did not have true data of temperature monitoring. Then the VVMs came, which are sensitive, but for VVM to show you a result, a lot of temperature variation has to take place. And now we have moved over to digital temperature monitoring, wherein there are digital data loggers, which are mini computers, and you put in the data logger after calibration into your refrigerator near the vaccines, and you take it out once in a week or so and attach it again to your computer terminal, and it gives you a reading throughout what has happened throughout the week. It takes temperature every 20 minutes or so. And if there is any deviation in between, it gives you an alarm also from the fridge itself. So you need not wait for the whole week. It will give you an alarm whenever there is a deviation, and you can get data for the whole week at the end of the week. So these equipments are there, which are being used in government setups now. So they are coming into the government setups. They have been approved, and we are using them. Now, next part is coming to the private sector. So now all this equipment, data loggers, everything costs money. And sadly, the private sector is still lagging in this field, because see, they are small, unorganized, not unorganized, but smaller setups wherein money does make a difference. So they are still with those domestic refrigerators, which are depending again upon the person who is using it, and then the chemist or the pharmacist who's storing the vaccine, what kind of training he has, what kind of mindset he has. So what does he do with the temperature monitoring? So they are still stuck with the domestic refrigerators. Now, what are the problems of domestic refrigerators? Number one, they are not meant for storing vaccines. They are meant for storing vegetables and food items, and their temperature control is very crude. So now, if you have a crude temperature control, for example, in winters in a city like Delhi, when the temperature is around 4 or 5 degrees in the night, the temperature of your equipment will go to below 2 degrees, even 0 degree. And in extreme harsh summers, when the temperature is 40, 45 degrees, the temperature crosses 8, goes to 10, 12 degrees. And believe me, I've been using a domestic refrigerator for some vaccine related studies, and I had huge problems with the data logger, not with the data logger, but with the equipment, that is the domestic refrigerator, because there was invariably loss of temperature maintenance every week. During summers, it used to cross, and during winters, it used to go below, and needed frequent adjusting. And even after adjustments, where it could not give us the correct needed temperature, and I had to file deviations along the way. So these equipments are not meant for keeping vaccines. Again, other than that, you need defrosting. So whenever you defrost, the temperature will go over 8 degrees, and then multiple openings of the fridge and all that. Then the variation in temperature in various parts of the fridge, this is another problem. So all this is there, which needs some kind of solutions, so that the practicing pediatrician in the private sector is able to have good quality vaccine, and the vaccine efficacy is not affected. See, vaccines, again, there are two kinds. One, those are heat sensitive. Second, which are cold sensitive. So heat sensitive vaccines cannot go over 8 degrees, and cold sensitive cannot go below maybe 2 degrees, or maybe 1 or 0 or 1 degree. And therefore, and it's a mix of both, which has to be kept in those refrigerators. So we need good equipment in the private sector with good temperature control, with good monitoring, good transport facilities, so that there is no loss of efficacy during transport. Now, coming to the second part of the question, what are the best practices? So as I have discussed, we need to upgrade equipment to ice-line refrigerators, or specially vaccine purposed refrigerators. Then we need digital temperature monitoring of all sites which are using vaccines. So there was a very good initiative by the name of EVEN, wherein digital monitoring is being done of these equipments, and whenever there is a deviation, alarm comes to the person who's using it, as well as to this headquarters, the main site wherein from which the vaccine is supplied. So we need some kind of a monitoring system, a centralized monitoring system for all vaccines, which should be tamper proof, so nobody can interfere in the way that system is run. Then regular training of manpower who handles vaccine, because a person, a pharmacist or a chemist who stores the vaccine, does not know which vaccine to keep where, or switches off the light at night when he goes home, because electricity is pretty costly. So all these things have to be taken care of. He has to be trained. Then arrangement of a backup refrigerator or a backup system, wherein you can store the vaccines in case of emergencies. For example, your refrigerator breaks down, or you have a power failure. So you need to have a equipment other than the one you are using, and you need to have a written guideline as to how to move the vaccines, what kind of equipment you will be using to move the vaccine, and whom to inform, how to do it. So all that needs to have a written protocol. Then another problem which we see is calibration of equipment. Nobody does calibration of equipment. So once you buy equipment, it is there till it goes kaput. So till it breaks down, it is being used. So some kind of regular calibration, maybe 6 monthly or a yearly calibration of equipment needs to be done. Then another good practice is written guidance and written policy of vaccination. So a new person joins, he should know, he should be given a document, okay, we have a written policy, read this up, and then we will tell you what to do. Because hands-on learning, of course, is important, but before that, he has to know what he is getting into. Otherwise, there will be lots of efficacy and damage to vaccines and vaccination failures. So then you need guidelines for all procedures like storage, stock in, stock out, near expiry vaccine, what to do in case of breakdowns, training guides for induction of new employees, temperature audit. So suppose you audit and you find that in a particular season or at a particular employee's working hours, the temperature is going haywire. That means either he's opening the fridge too frequently or he's not shutting the fridge properly. So temperature audit, then calibration guidelines, calibrating every 6 months, keeping a record, equipment maintenance record. So all these guidelines, written guidelines and protocols should be in place. So these are some best practices which can improve our vaccination efficacy in the country. Thank you so much.
Thank you, Dr. Anurag, for beautifully underlining the best practices the pediatricians should be following. So, my next question is for Ms. Urvashi. How can implementing the right digital infrastructure across cold chain networks transform last mile connectivity?
Yeah, I think, I mean, a lot has already been said on this, but I'll just maybe make a few other quick points at a higher level. Progress that we've made, especially post-COVID, in terms of especially the use of technology and the integration of technology. And we've heard a lot about that, in terms of the remote sensing and the smart tracking, the IoT, all of this. And in fact, we are expecting the cold chain market itself to be a huge market in India, to and a huge market opportunity as well, apart from the fact that it obviously is crucial for the medical sector and the health sector. But it's also a big market opportunity, and I think that should lead to further kind of innovation in the space. But I think one other very interesting area where, of course, technology is being used is that we're using it for predictive analytics via artificial intelligence and machine learning to analyze consumer behavior and also forecast potential supply chain risks. So that is another very interesting use that we're now putting technology to. And in fact, the entire supply chain, whether it's the shipping routes or any aspect of it, we're using real-time GPS positioning. So a lot of this is being used, but I think it's very important to, like I said, we are a very diverse country. We are at very different stages of development still across the country. And so there is a lot that needs to be done to bridge those equity gaps that exist, especially rural, remote areas, areas with difficult terrains, tribal areas. And of course, in COVID, we saw, and a lot of those advancements and innovations have been spoken about also by other panelists. And in general, India's vaccination program is one of the largest and most advanced in the world, because even if you look at the US, for the COVID vaccination, they were still giving you these slips of paper, whereas here we had pretty much everything digitized. Obviously, there were issues, there were challenges. The app would have issues or lacunae from time to time, and that's, I think, only inevitable in a country of our size and diversity. But what we managed to achieve was still phenomenal, compared to even where some of the developed world is currently. So I think all of that is very good. But I also agree with the point that was made about environmental sustainability, and so use of solar, etc. And I think it is very important to implement sustainability to the state of the art medical grade devices, monitoring their operations through remote sensors, and enhancing transparency through software solutions. So I think these are all very, very important initiatives that we do need to take. And of course, sustainability in everything now, as we look at Viksit Bharat at 2047, which is the overall goal that the Prime Minister has set out for us. Sustainability in every way is a very big element of that. So, of course, we want to enhance and maximize the efficiency of the health system, the medical system, and technology, is going to play a critical role there. But that has to be balanced out with sustainability. So I think that is, one very important message. And of course, I think lastly on technology, I would just say that a lot of times we get very excited, carried away, with these are all buzzwords that have now come into being in terms of AI and ML and IoT and but ultimately, whatever systems we come up with, they have to be very contextualized to our local conditions, prevailing conditions. They have to work there, and they have to be able to work at scale. And all the stakeholders, it's very important to build the capacity of, because sometimes with technology we can forget the human interface and the human element. So it's very important to build the capacity of all stakeholders to now be able to use these technologies effectively in this context and to integrate them with the entire pharma, medical, supply chain, value chain. So yeah, I'll leave you with these comments, and I'll just need to leave as well for a meeting. But thank you very much for having me here.
Thank you, Ms. Urvashi, for joining, and thank you for those great views. So we'll be moving on to the next question. The next question is for Mr. Shahab. What role can smart storage equipment play in driving efficient cold storage? And what are the future technologies that can help in building sustainable medical cold chain infrastructure, which can work towards solving energy associated problems?
Sure, thank you, Rashmi. Like previously mentioned, I think a lot of the examples were already talked about. I'll talk about two more that were not already mentioned to give an idea of what else is happening right now. Um, I'll start with a story on last mile outreach of vaccines from the sub-center down to the village, and particularly in a region like the northeast of India where terrains are so difficult and distances between villages can be very long. Typically, what happens is at the sub-center level, vaccines are not stored permanently. It's usually stored at the primary healthcare center. The A&M at the sub-center would usually go in the morning on the allocated vaccine day and travel to the primary health center, pick up the vaccines from there in a ice box, in a vaccine carrier, a passive vaccine carrier, and that would then be delivered down to the villages. In many cases, um, the distances between these villages is actually really long. In one particular case, the A&M had to travel from the sub-center down to the village for 4 to 5 hours on foot. And the holdover periods of these vaccine carriers is limited. So you can imagine the A&M rushing to the PHC in the morning, then making it to every village, about 6 villages or so, and then coming back in the evening to return it to the PHC because the vaccines will then get spoiled. And that's where these new technologies, we've been working with a lot of companies now on this. One of them that we have deployed to a large extent is a portable vaccine carrier, which uses phase change material within it. So the holdover period at the carrier level increases to 8 to 10 hours, even in cold conditions, or even in warm conditions rather. And that tremendously changes the ease of operations for an A&M, the cost that are involved. So what the A&M can now do is pick it up in the morning and then even wait to deliver it back to the PHC at a more comfortable time. Because the whole sub-center is also solar powered, the vaccine carrier can actually just be plugged in at the sub-center level itself. And the vaccine can also be stored till the next time that they're used or returned to the PHC at a, like a more easier time, probably the next morning. They can also freely go to the villages, spend enough time over there without worrying about the fact that, the vaccines are going to get spoiled and then rushing from one place to another, not being able to do enough outreach activities and so on as well. So multiple effects because of a cool new technology that has come out by the private sector. Another example on the future tech, I'll quickly, I don't think this is really future, but it's a different kind of technology that's being implemented by quite a few people right now is drones for logistics, improving logistics. What this does many a times in these remote areas, having centralized stores doesn't make a lot of sense. You might not have enough volume in the first place to maintain storage systems everywhere. So this is something that is being experimented on, not just with vaccines, but also sometimes with blood samples or other kinds of medical products. And it's like a hub and spoke where vaccines are delivered just in time rather than um, having that central that store being available at the last mile. So this is especially important if PHCs etc. are really far away from the sub-center or and so on and so forth. So there were three questions. I think I've clubbed that here. And
Okay.
yeah, thank you.
So, this is the last question, and it is addressed to Dr. Madan and also your views, Dr. Anurag. How crucial is training and capacity building for healthcare professionals involved in cold management system? Starting with Dr. Madan.
I think this has been already answered because the issues and other things regarding the cold chain, they have been explicitly expressed by the earlier speaker. But nevertheless, I will just highlight what we have been doing, because the whole essence of this vaccination program is maintaining the potency of the vaccine. If you are able to maintain the potency of the vaccine, and this potency of the vaccine is a crucial thing, and it will reflect the efficiency, because we are inoculating. We don't know whether the vaccine is efficient or not, but at least we can ensure the potency of the vaccine by maintaining the cold chain. That's why these people become very important. For the program success also, the cold chain becomes very important. You see, why the vaccine in mRNA vaccine, the Pfizer's vaccine, could not work in South Africa. Why could not work? Because they didn't have the cold chain. They have given vaccines to them. They have donated vaccine, but they were not knowing how to store that vaccine and use that thing. That's one thing. That's a different thing. But we do have training programs for maintenance of the cold chain. We have understood that there needs to be, because the breakdown time, the holdover time is there, is limited. But if some ILR refrigerator breaks down, we need to train them for maintenance of all these things. That's one thing. That maintenance aspect is already been taken. Maintenance of the deep freezers, the ILRs, as well as your vaccine carriers, the cold boxes. This is required. So our training program is there. The National Institute of Health and Family Welfare, they usually undertake training programs, all the people who are handling the cold chain equipments and other things. Second thing, if you look at one of the other important aspect is use of technology for monitoring the cold chain. How many cold chains are working or not. So we are trying to, we were using the EVIN. Now the COVID platform would be used increasingly for monitoring the status of this cold chain vaccinations. The other aspect of the cold chain is the safety and accountability. In case of any, if the repeated heating and cooling, the thermodness, if it happens, if the vaccine vial monitors, they show a change in color. At that time, these vaccine handlers, they can take a call, they can inform that the vaccine is not suitable for vaccination. So we need to train them. So that's why this training and vaccine becomes very important. The other important aspect which we need to emphasize is the data management record keeping of all these equipments. We do have program for annual maintenance contract for these deep freezers and the ILRs. That is now inbuilt. But who will track? The cold chain handlers have to track it. They have to maintain data. They have to maintain record. Apart from that, in case of any adversities, which has happened, which has been pointed out by Shahab, that in case of any adversities, what is the next line of action? And we need to train them on that kind of action also. And obviously, all these aspects, all this training needs, they have been addressed in the training needs in the training program, which has been rolled out across the country. And NITI is the nodal agency for doing this training program. That means we are on the right track of seeing that the cold chain equipments, everything is maintained, so that we can at least bring in confidence into the people that at least whatever vaccine from the manufacturers to the beneficiary, the cold chain is maintained, the potency is ensured, and the vaccine vial monitors which are there in now all the vaccines, that is also is not changing. So this, at least we can at least give confidence and assurance that whatever vaccines which we are having in the universal immunization program, national program. So that is safe, potent, and efficient.
Your views, Dr. Anurag.
Yeah, I think Sarah has highlighted a lot of important points. And training and capacity building is a very important component of any government program, or in fact of any system which we need to run. See, pediatricians also have to read how to manage cold chain. Things have changed over last 2 decades. Equipment has changed, guidelines have moved on, and pediatricians do read. But as I said again, only that more than 90% of immunization is done by people who are not pediatricians, healthcare workers, but not pediatricians. And Sir has rightly pointed out that NIHFW and state governments together conduct lots of annual programs in which they train the nursing staff and the ashas and anganwadis and medical officers who are posted in immunization centers as to how to run the program as per guidelines. We have a problem of rotation of nurses in hospitals and dispensaries, wherein a trained nurse is moved out from immunization to some other, say for another ward, for example, orthopedic ward. So the training is lost, or for the training somebody else is sent who's not working immunization clinic. Of course, these minor glitches are there, but yes, we have a program in place in the government. Now coming back to the private sector, there is no training program there for private sector. Nobody does it. Government also does not invite private pediatricians or nominations from private sector pediatricians or people in private sector who are giving immunizations to send their staff for training. So I think this component needs to be included in the government programs, that practitioners can be requested to send their staff who can go to these trainings and learn how to manage cold chain, how to manage vaccines, how to prevent loss of efficacy in vaccines. So again, so when somebody goes for training, he will be given guidelines. He will be told what is calibration, what is equipment maintenance, what is temperature data logger monitoring, how to do it. So yes, these are important. Then which vaccine to keep where, if he has a domestic refrigerators, for example, if you use a domestic refrigerator, you need to keep T series vaccines in the lower shelf, whereas the heat sensitive vaccines in the upper shelf. So BCG and OPV will be topmost. Below that, there will be MMR. And below that, it will be T series vaccine and hepatitis B and maybe typhoid vaccine and rabies vaccine. So all these kinds of trainings should be given, have to be imparted to anybody who is working with vaccines. In fact, a certificate course also can be started by some agency in cold chain maintenance. For our pharmacists who store these vaccines, they also need to be trained. Yes, there is a licensing mechanism. Every pharmacist cannot sell a vaccine. To sell a vaccine, you need to have a special license, which is provided by the licensing authority. I do not know which one. I don't remember. But these people need to be constantly trained so that their knowledge and skill is upgraded. Because once they get a certificate, they will not go for any training, and things change. They do not know about it. So yes, upgradation of skills are required, and this should be a phenomena which should be a part of the curriculum. Thank you.
Thank you so much, Dr. Anurag. So this brings us to the end of this discussion.
I just wanted to share one quick
Yes.
thought on this training and capacity building. Outside of the infrastructure and that sort of training, there's an interesting point around training of end users also, building health outreach and how that sort of affects the cold chain. In a lot of times, what happens is that a vial of a vaccine will have multiple doses. And when you go into a really remote area and there is so much superstition around vaccines or some sort of apprehension towards taking up the vaccine, then that entire vial cannot be used. And that impacts that cold chain delivery also considerably. So looking at health outreach of how accepting people are towards vaccines is also important in certain areas, and perhaps some effort should also be strengthened there to complement all the great work that the government is already doing.
Thank you. Thank you, Dr. Shahab. We have one audience question. So, how to tackle unorganized and substandard vaccine cold chain equipment in the market through enhancing policies and stringent quality certification? Dr. Madan, I addressed you.
It's a very broad question, which because in the government sector, I can tell that the specifications are defined. Because if you are buying a vaccine carrier, so the specification are decided. The specification for that committees are there. The experts are there in that committee. They decide the specification. Based on the specification, procurement happens. Even after that, the quality assurance mechanism is there for the government sector. But once it comes to the private sector, because that's rightly pointed out by Anurag ji, that the training is more important, and they are using the common refrigerators for storing the vaccines. And when the store is shut during the night hours, they usually shut all the things. That's one thing. But the question, but is that if we have set a standard that for a ILR, this is the specification, these are standards. What is the turnaround time? What is the holding time? So if we are able to decide on the holding time for a ILR or a deep freezers, at least we have ensuring something. That means if there, in case of power outage and other things, at least the vaccine will be safe for 3 hours, for 2 days, 3 days, 4 days, that kind of thing. But for the government side, from the government side, specifications are listed out. They are decided which kind of this, with the help of international experts as well as, because from the international experts, the UNICEF and the WHO, they usually help us with the specification. But there are other experts also at the Director General Services who are experts in bringing out the specification of the thing. And based on the specification, tenders and other things are floated, and based on that, procurement happens. And a quality assurance mechanism is also in place for ensuring that whatever equipment are being procured, they are there. Besides that, we do have a scheme for comprehensive maintenance contract, because once we are ordering something, it is an inbuilt comprehensive control contract mechanism. That means for 3 years or 5 years, the equipment would be on the site, would be serviced by the provider. That's one thing. Second thing, when the equipments which are beyond the CMC, the annual maintenance contracts are being supported by the government, so that the functionality of the equipments are being maintained as per the specification. The equipments are being supplied, so that the potency, the whole objective is that how to maintain the potency and efficiency of the vaccine by maintaining the cold chain. That is ensure. I think I've been able to answer that. For the private sector, for regulating the devices and other things, if they are manufacturing it, if somebody is trying to buy it, they have to buy as per the specification, standards, requirement, holding time, and as well as in case of any outage, how many days it can. The Iceland refrigerators, if it is cooled properly, it can hold the vaccine for 3 to 7 days, depending on the areas and other places. So that kind of thing. Iceland refrigerators, they have strengthen the program like anything. The deep freezers are there and the vaccine carriers. The 8 to 12 hours you can hold, and after one session you can come back. Because the ANMs usually they have a route chart to overcome the problem of that. They do have a route chart in which if only one session is per day, it's not 6 sessions, 7 days. She collects the vaccine, goes to the session site. For reaching the session site, also some transport, even the motorcycle and other things have been provided. That means she can hire a motorcycle and go to that site, use the vaccine, and come back. But there are other policies also. Even if a single child is there, some of the program, if a single child is there, usually nowadays what happens in the village health and nutrition days, you collect all the people, and based on that you open the vial. But some of for more the vaccines, the policy is that even a single child is there, you open the vial and then let the things discard. And you see that how efficient our workers are there. In the COVID times, usually the manufacturer, they put in 1 dose extra, factoring 10% to wastage of the doses. So for in a COVID vaccine, for a 10-dose vial, there were 11 doses. Our workers are so efficient in minimizing the wastages. That means instead of 10 doses, they have inoculated 11 doses. Because 10% wastage also they have utilized it. So that's another aspect. That's another webinar we should be having for how to prevent the wastage and other things. But they have been all trained. All the essential things are there. equipments are brought as per the specification, which are decided by the experts. The experts include international experts as well as the national experts. And after the procurement, the equipments are being provided comprehensive maintenance as well as annual maintenance, depending on the type, depending on the age of the equipment. This is all which I can say. But regulating the equipments in the private sector, that's beyond the scope of these discussions.
Thank you, Dr. Madan. Mr. Shahab, you wanted to add something?
No, I think sir already mentioned the fact that UNICEF and WHO do publish also complementing to a lot of this on the private sector side. They have a cold chain equipment optimization platform, which UNICEF runs together with Gavi, that publishes a lot of material online on this.
Thank you. Well, that brings us to the end of this very interesting webinar. And I really want to thank all the speakers for sharing those meaningful insights on how we are using technology in strengthening medical cold chain infrastructure and its impact on immunization programs in difficult to reach areas. Appreciate all experts for joining us today, and a very big thank you to the attendees for joining in. Please take care and stay tuned. Thank you.